Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
We have discussed the 29 individual pulses. However, those pulses seldom appear alone. It is more common to see that two or more pulses co-occur, which is called a combined pulse. This video discusses how to explain the clinical indication of a combined pulse. What is a combined pulse?
The pulse that merges two or more single pulses or are compounded by several single pulses is called a combined pulse. We have learned 29 pulses. However, clinically, these 29 individual pulses seldom occur alone. In the course of a disease, several types of pathogenic factors usually attack the body simultaneously. Several pulses occur at the same time. For example, the floating and rapid pulse, slippery and wiry pulse, deep, thready, and slow pulse. They can happen together. Pairs of opposite pulses, such as floating pulse and deep pulse, slow pulse and rapid pulse, the deficient pulse and excess pulse, they cannot occur together because they are opposite, but all other combinations of pulses are possible. Please notice, among the 28 pulse conditions, 16 belong to single-featured pulses, such as the floating pulse, deep pulse, slow pulse, or rapid pulse, and some combine several features. For example, the weak pulse owns features of deficient, deep, and thready. The firm pulse has 5 characteristics, namely deep, excess, large, wiry, and long. So it is impossible to see a floating and a weak pulse appear together, or a floating and a firm pulse together. But you can see a floating and forceless pulse occur together in one case.
How to explain the clinical significance of a combined pulse?
In terms of the clinical significance of combined pulse, it's kind of like we are doing the math, 1 + 1 = 2. These combinations usually reveal the conditions indicated by the individual pulses. If you know the individual pulse indication, add them together, that's the combined pulse indication. For example, a floating pulse suggests an exterior syndrome, generally speaking, while a tight pulse suggests a cold syndrome. Therefore, a floating and tight pulse indicates an exterior cold syndrome. Isn't that straightforward? So you use this philosophy to make your syndrome differentiation. Floating, tight pulse. You find this pulse is floating, it's tight, so it suggests an exterior cold syndrome. With the same logic, you find a pulse which is deep and slow. We know deep pulse suggests interior syndrome. Slow pulse suggests a cold syndrome. So a deep and slow pulse suggests an interior cold syndrome. Now, if you find a pulse is deep, thready, and rapid, what's the suggestion? You look at the individual indication. Deep pulse suggests an interior syndrome. Thready pulse suggests a deficiency syndrome. Rapid pulse suggests a heat syndrome. Therefore, deep, thready, and the rapid pulse suggests an interior heat deficiency syndrome. You just put them together. So kind of like a detective. You get that information and you make a story to explain. This conclusion can explain whatever you already found. That's what we need to do.
Frequently seen combined pulses and their clinical indications.
First one is a floating and tight pulse. It indicates an exterior cold syndrome or wind cold dampness impediment syndrome. We have discussed why a floating and tight pulse can be seen in an exterior cold syndrome. However, why can a wind cold dampness impediment syndrome or a B syndrome also have a floating and tight pulse? Actually, not all types of B syndrome have a floating and tight pulse. Only when the B syndrome is mainly caused by wind and cold pathogens is the pulse revealed as floating and tight. Now, a floating and tight pulse can indicate two syndromes, an exterior cold syndrome or a B syndrome. Which syndrome is indicated by a floating and a tight pulse? This is the time to combine all the data collected by the 4 examination methods and not rely on the pulse alone to make a syndrome differentiation. For any exterior syndrome, the patient will experience fever and aversion to cold simultaneously, not to mention signs and symptoms such as headache, general pain, stuffy nose, or sneezing, etc. But for Wind B syndrome, what the patient complained about would be migrating joint pain. When combining other accompanying signs and symptoms, it is very easy to tell what a floating and tight pulse points to. Floating and moderate pulse indicate exterior deficiency syndrome due to injury to the defensive qi by wind pathogen, disharmony of nutritive defensive qi, and the wind attack of Taiyang. The exterior wind pathogen is a yang pathogen that tends to loosen the chole, which is the striae of the skin and the muscles, and open the pores. When the wind attacks the body surface and beats the defensive qi or wei qi will be inhibited inside, leading to a situation in which the defensive qi is more intensive than the nutritive qi. Nutritive qi is also called nutritive blood, so this situation is also called disharmony of nutritive blood and the defensive qi, and its main symptoms are fever and spontaneous sweating. As this is an exterior syndrome, the qi and the blood of the body fight the pathogen in the superficial part of the body, so the pulse is floating. The defensive qi is inhibited inside, thus heat is generated, leading to the looseness of the blood vessels. As a result, the pulse becomes moderate. We mentioned before that a moderate pulse has 3 meanings. In a physiological state, a moderate pulse refers to a balanced and harmonious state, where the pulse is neither fast nor slow, neither tense nor loose, which is a sign of a sufficient stomach qi. In a pathological condition, a moderate pulse can refer to a pulse condition whose pulsation rate is slower than regular but faster than a slow pulse. And a moderate pulse can also indicate that the tension degree of the blood vessel is loose, which is opposite to a tight pulse. Here, a moderate pulse in an exterior syndrome caused by interior wind means that the pulse tense degree is loose. When an exterior wind invades a body, this is an excess exterior syndrome. However, because the symptoms contain spontaneous sweating, which looks like the defensive qi was deficient and could not secure the exterior, therefore, this true excess exterior syndrome is also called a deficient exterior syndrome, though the deficiency is not true. On the other hand, Taiyang channels dominate the superficial part of the body and work as the fence of all the channels. When the exterior wind invades, Taiyang channels will be involved first. Therefore, this exterior deficiency syndrome is also called Taiyang wind-induced syndrome. Floating and rapid pulse indicate an exterior heat syndrome due to an attack by wind heat. The indication of a floating and rapid pulse is straightforward. Generally speaking, a floating pulse indicates an exterior syndrome, as the fighting against the invading pathogen happens in the superficial part of the body. And a rapid pulse results from heat, as heat accelerates blood flow. These three, all floating, belong to the exogenous disease. Now, notice that the pulses of exogenous diseases have a common feature of floating, but depending on the nature of different attacking pathogens, the pulse can be floating and tight, floating and moderate, or floating and rapid. Another combination, see often, slippery and floating pulse. Usually it indicates an exterior syndrome with retention of phlegm or winged phlegm. Floating usually indicates exterior syndrome. Slippery, individually, it indicates a retention of phlegm. It usually found in patients who used to have excessive phlegm and later contracted to external pathogens. This is a coexistence of interior and exterior syndrome. This person has already had an interior syndrome in the first place and later contracts an exterior syndrome. Again, whenever you see the combinations of the pulses, you will work just like the detectors to explain how it's possible for these different pulses to appear together. So the story you will give would be there's a person, this person has a excessive phlegm first, so they already have a slippery pulse. Now this person has contracted external pathogen, so you see the slippery and the floating pulse. That's how you explain this one. The same idea for the deep and slow pulse. Deep pulse means it's an interior problem. Slow pulse means there's a cold. So a deep and slow pulse indicates an interior cold syndrome, usually found in patients with spleen kidney yang deficiency or cold accumulation. To further differentiate whether it belongs to the spleen kidney yang deficiency or belong to cold accumulation, you will look at the strength. If the strength of the pulse is forceful, that's the excess type. So you can say it's a cold accumulation. If it's a forceless, deep, slow, and forceless, that can be the spleen kidney yang deficiency. Please notice that with yang deficiency, we can see a deep and slow pulse. Then, why specifically say spleen and kidney yang deficiency? This is because among the 5 Zang organs, the spleen and the kidney are the organs most likely to have yang deficiency type of problems, just like the liver, lung, and the kidney tend to have yin deficiency type of problems. By analyzing other accompanying signs and symptoms, we can pinpoint the exact Zang organs involved. Another combination, deep and moderate pulse. The moderate pulse we know is usually associated with the spleen deficiency, and the deep indicate interior problem. Put it together, it indicates retention of water dampness resulting from a deficiency in the spleen. Here, moderate pulse has the meaning of slower pulse rate than regular due to dampness or spleen qi deficiency. For a deep, thready, and rapid pulse, this one indicates an interior deficiency heat syndrome, often found in patients with fire hyperactivity, result from yin deficiency in a protracted disease. Yin deficiency produces deficient heat, and heat will accelerate the blood flow. Therefore, you see rapid pulse. Yin liquid is insufficient to fill up the vessel, so the pulse is thready. The yin deficiency is an interior problem, so you see deep pulse. That's why you see the deep, thready, and rapid pulse. From deep, thready, and rapid pulse, you infer the syndrome is the yin deficiency syndrome. The yin deficiency syndrome can perfectly explain why deep, thready, and rapid pulse exist at the same time. You may wonder, since a thready pulse also indicates dampness syndrome, why does a deep, thready, and rapid pulse not indicate an interior dampness syndrome? This is because this assumption cannot explain the fact that the pulse is also rapid. For interior dampness syndrome, the pulse rate should not be rapid. This is the rationale for this inferring of indications. Wiry and rapid pulse indicates liver heat syndrome, often observed in patients with fire transformed from stagnant liver qi or damp heat in the liver and gallbladder. If it's rapid, you think about heat. Wiry usually associated with liver and gallbladder. Put it together, you see wiry and rapid pulse. Full and rapid pulse indicate excess heat in the qi system and usually appearing in the intermediate stage of the febrile disease due to external contraction. The rapid usually associated with heat. Full pulse, we know it's more superficial. Light touch, you can feel it already. And it's large and it's rapid, so it's heat. The heat is not deep yet. The heat is still in the qi level. Qi level is a level a little deeper than the superficial level in the febrile disease. Put it together, that's why you see full and rapid pulse. Deep and wiry pulse together, indicating liver qi stagnation or cold retention in the liver channel or water retention. Think about the wiry. Wiry is associated with liver disease, associated with pain or with water or dampness retention. You use them to infer the possible syndrome leading to the disease. Deep and choppy pulse indicates the blood stasis syndrome, usually often found in patients with the syndrome of cold accumulation and the blood stasis from Yang deficiency. Cold is a yin pathogen whose primary characteristics are condensation and obstruction, which slow down blood movement and thus generate stagnant blood. Deep and choppy pulse can also appear in a mixture of excess and deficiency syndrome. For example, hot yang qi deficiency can lead to a weak power in driving blood circulation, accordingly producing stagnant blood. Either case can generate a deep and choppy pulse. Wiry and thready pulse indicate liver kidney yin deficiency, blood deficiency, and liver qi stagnation or liver qi stagnation and deficiency in the spleen. Because thready is a deficient problem. And there's wiry, so it's related with liver. Therefore, put it together, it's all possible to see this. Here, we can see that a wiry and thready pulse can appear in a deficiency syndrome, such as liver and kidney yin deficiency syndrome. It also can be seen in a syndrome where deficiency and excess coexist. For example, at the beginning of a disease, a patient has liver qi stagnation, which is an excess problem. Later, as wood tends to over-control earth, spleen qi becomes deficient. So you see liver qi stagnation coexists with the spleen qi deficiency. As the spleen qi becomes insufficient, the production of qi and blood will not be enough. That is when one can see a syndrome of blood deficiency and liver qi stagnation. When the liver blood deficiency develops to an extent, kidney yin will be involved, as the kidney is the mother of the liver, and thus finally leads to both liver and kidney yin deficiency. At the different stages of the disease, a wiry and thready pulse condition may be present. This is another example of how we should not rely only on the pulse condition to differentiate the syndrome. We must always combine other accompanying signs and symptoms to see the big picture. Slippery and rapid pulse indicate syndromes of flame heat, flame fire, damp heat or heat due to the food retention. As we know, a slippery pulse can indicate phlegm and body fluid retention, food retention, and excessive heat in pathological conditions. When there is excessive heat, or when the phlegm, dampness, or food retention turns into heat or fire, a slippery and rapid pulse occurs. Wiry, slippery, and rapid pulse indicates liver fire with phlegm or upward wind disturbance by Yang, damp heat in the liver and gallbladder, or phlegm heat accumulation syndrome. We just discussed the indication of a slippery and rapid pulse. When a wiry pulse appears along with a slippery and rapid pulse, it indicates that the liver or gallbladder has been involved, or the phlegm and the fluid retention has made the blood vessels wiry and string-like. Liver fire with phlegm, damp heat in the liver and the gallbladder, or phlegm fire accumulation syndrome can all generate a combination of wiry, slippery, and rapid pulse. As to the upward wind disturbance by Yang, this is another expression of internal wind generated by hyperactivity of liver fire. We know that excessive heat can lead to a slippery pulse, thus a wiry, slippery, and rapid pulse can be seen in this type of internal wind syndrome. You just look at the indications of individual pulse and combine them together. If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!